to the Reimagine Patient Engagement Podcast. This podcast aims to answer the changing dynamics in patient engagement. What role does technology play in the space, and what are the key initiatives and metrics each individual in the ecosystem expects? Let's get started.
First of all, thank you so much for joining. We're really excited to have our listeners hear what you have to say, and you've really been kind of the guru in just healthcare. And I think it would be great for our listeners to kind of just know a little bit about you. You've had so many different roles. You have an incredible career. You've been an oncologist, physician oncologist. You've worked on the policy side, and now you've made that leap into digital health. And, you know, we're really in this digital health era. I think we're kind of teetering because some of us are there and some of us aren't. And maybe you could share a little bit about your background and what really made you, make those switches.
In terms of my background, I started off actually back in the early 1970s in the National Cancer Institute at a time when oncology was literally just forming as a specialty. I know that's hard to believe today, some 50 years later, but there was no specialty of oncology and it was just getting started. My training and then decided for a variety of reasons to go into a private practice situation. And I was probably one of the first that went into practice. And the oncology we know today, as I mentioned, didn't exist back then. So we were faced with no payment. We were faced with no structure. We were faced with no examples and really dove in. We did clinical trials. We did everything right out of a private practice in Baltimore, ran a cancer program at Sinai Hospital in Baltimore. But over the course of time, became a little bit not disillusioned, but the reality was we could not do much for our patients. So I spent some time in primary care, internal medicine, decided at a point in the mid-90s that I wanted to at least give a shot at businesses because I felt that we needed to do better in how we delivered care to patients. And I thought we could do that through improved primary care. Spent some time there. Ended up at the American Cancer Society as a medical editor. But it was an interesting journey there because I was able, for a variety of reasons, to become involved in media and serve as a spokesperson on behalf of the society, but really watch the beginning of what I would call modern oncology. Drugs like Herceptin, Gleevec, those drugs were just coming in. And finally, we had a shot at doing something really positive for patients. I don't think the promises that we thought would come forth at that point in time were really realized until a number of years later. And so here we are today as we're having this conversation at a time when there's so much more we can do for people. We know a lot more about how to prevent cancer. We know a lot more about how to detect cancer early, and we're learning as we speak here today about early detection. We know so much more about how to treat cancer. I talk frequently about breast cancer. There are literally thousands upon thousands of women who participated in clinical trials to help us answer the questions. I started in the era of modified radical mastectomy. It was a devastating operation. A woman would go to sleep not knowing whether or not she had cancer, and she would wake up without a breast. And that was terrible. But as we use that as an example of the progress that we have made in terms of understanding how to better treat patients, how sometimes not to treat patients, which is also equally important. Right. So here I find myself and at a point where I think we need to pay a lot more attention to patients, caregivers, people who are there who love those with cancer and help them through the journey. And digital is not new for me. I was involved in thinking about it 30 years ago, but here we are today, and I'm involved in digital health, and I hope the transformation of oncology, how we can improve the quality of care and pay more attention to those with cancer, and particularly, as I refer to, communities in need, the topic you may be very familiar with, communities in need, so we don't end up in this digital divide that some of us talk about from time to time. I have gone from a period a couple of years ago where I thought we really couldn't do much to being genuinely excited. I'm not somebody who gets on a rooftop every time a new development comes along. I'm now excited may not be the best word, but I think there's so much more we could do if we just did what we already know and utilize the science of what we are learning going forward. So that's a quick summary of a complex period of time, having seen a lot over the years. I don't think that there's a more opportunistic time, but we also have to pay attention to the fact that I don't think one of the reasons I'm in digital oncology at the present time is because I don't think we're really delivering on the promise that we hold within our hands when it comes to caring for patients and supporting them through this journey.
Absolutely. I love it. You're a builder and innovator. You've done some great things. And if we could kind of like jump into technology, because what I really found, that digital divide is there. It exists. Yes. So I think for some people, the leap to having, your phone help enable your care, for a lot of people, it's not there. Working in high-risk communities, they don't have internet in their home. So there are still barriers that we have to cross. The other side of it is I think there's really barriers on the physician and the provider side. Everybody kind of hangs on to everybody. It's like my patient, and we're still kind of like in this tunnel vision a little bit. And it's really hard, I think, with that sharing. Like, perfect example, I met with a nurse practitioner last night, had dinner, and kind of feeling her out about physician practices and how they're engaged around using kind of like an outside vendor to help, with extended care and be that in between visits. And they're really against kind of letting other people in. So from your experience, talk about and I know, oncology is a chronic disease. So to me, I kind of lump it all together, but looking at how technology is shaping the future, what are some of the things that we really need to do to bridge this gap and look at how could we really use technology to enable care instead of seeing it as something that's, not mine, or I don't want to kind of relinquish it or give it up.
That is a absolutely critical point. First off, and let's talk about digital divide, because we think of it in terms of communities in need and cities, but we also have to recognize that this is a very large country with a lot of places that are rural, including we happen to have a home up in North Georgia where people don't have access to the internet as well because they don't have a signal that enables them to do it.
Sure.
We have what I call an edifice complex. We have really terrific people in oncology. I have to say, we mentioned the nurses, the nurse practitioners, the PAs, the support staff that never gets the recognition. I recognized literally decades ago that even the people who helped straighten up the room and the patient in the hospital at that time got to know the patient sometimes better than we did as the clinicians. Mm-hmm. So we have to start thinking in terms of how we're going to deliver team-based care. And I tell patients constantly, get to know the nurse who's helping to take care of you, because he or she is the conduit to helping you through this journey. I'll tell you what I've seen, and it's not just in oncology. Very quickly, my wife, she used to be an OBGYN in South Georgia, a rural community, and they had what they call care management organizations making phone calls up from Atlanta with nobody on the ground, no attempt to integrate within the practice. There was a major practice in that small community. And yeah, it was very divided care. So you have all these entities out there saying, well, we've got this bank of people to help with this and a bank of people. But the integration, the team piece, that is, how do we work together to make it better? We all, and I'm sure many who are listening to this podcast are aware, our oncology workforce is getting hammered. Our patients are getting hammered. They're making phone calls that nobody's responding to. So we need to say, what can we do? And I think this is so critical as I talk in my daily work as well. Let's remember, we need to find efficiencies, and I don't mean just efficiency monetarily. I mean efficiencies in how we deliver care. What are the structures? What are the elements that we can take some of the burden off of the clinicians and improve the patient's care and make it a team effort? So if we have dashboards, and we have a capability, I always refer to the Fitbit, the monitor I wear, the data that I get every day myself. How do we take that data and analyze it and have a team? One more dashboard on the clinician's computer is not going to help us get us where we need to be. So I think, coming back to the point you're making, so much of it is balkanized in terms of our care. So much of it is this one does that one does. How are you going to make it work together? And I do believe that we are at a point in terms of our technologies where if we have the right people helping to design those technologies, we can make this happen. And we can help answer those questions, whether it be digitally, online, or whether it be by phone. It's going to be hybrid or with a person. Right. But we have to figure out how to reduce the burden on the people who are hands-on giving the care and make their care, allow them to do the care they want to do to make that care better for patients. I keep coming back to patients and caregivers because they're a very important part of this picture as well.
Absolutely. And when you think in terms of the burden, sometimes just the data alone is the burden and the fear of not knowing. And from my experience, just finding that the fear of technology or not knowing is, they're thinking liability, they're thinking of a multiple different, a lot of different things. And it's how do we alleviate that fear? And then how do we really bring that data into micro-sized bites that they could actually use to really improve care? And how do we get them comfortable doing it? So I think in some respects, we have a lot of work to do, but in a lot of respects, I think the technology's there, and now we just have to prove it, right? We have to show it, prove it, and I think it'll start to happen. But like I said, It's still a ways away.
It's a ways away, but there's some really incredible teams of people who are working on it.
Absolutely.
And we all, and again, you're very well aware of this. So everybody's focused on how do we keep people out of the hospital. What kind of signals do we get? And maybe somebody out there has that answer today. I'm not sure they do. We're going to get there. We're going to get there, and we're going to be able to spot somebody as they're getting into difficulty. And at least that's the hope. Now, we won't spot everybody. But, I have to go back and just remind everyone that it was, 6 years ago, that a paper was presented at the plenary session at ASCO that demonstrated that communication between care teams and patients improved outcomes. That's the short version. That wasn't so long ago, but the technology they used? They used email.
Yeah.
They were sending email messages to each other. We can do a lot better than that today, and I think we can use those technologies in so many ways to help improve the quality of life for people and improve the journey. And yes, reduce the cost of care, because we've got to do something about keeping costs under control so people can still afford to get the care that they desperately need.
Absolutely. There is something on LinkedIn today. There was a survey that was just done. I think Beringer Ingelheim did it, but they looked at what do primary care physicians and physicians want and what do patients want. And one was really spending more time with each other. So when you look at that, and as those words get out, I think it really is going to pave the way for technology to really enable and enhance that communication today. So I think everything's in place, and I think it's just now, just rolling out. I think this whole digital era is just kind of I feel like it's just there. Even in the organizations that I belong with, I feel like it's finally there, and now it's just embracing it and teaching. There's a learning curve as well that we have to really educate, providers and also patients. And patients are, the people I take care of, they're very willing to do it. We gave cell phones. They've learned how to do it. We have caregivers that never had a computer that learn how to do it and love it and embrace it. So it's really providing opportunity. And I just think we have to do more of that.
Well, we also have to figure I agree with you. First off, it reminds me of that phrase, it was an overnight success. It just took me 30 years to get there. So I think we're at that 30-year point where we can do it. Number one. Number two, you said something that I've got to give a shout out and reinforce. I have been both an oncologist and a primary care physician. Our primary care workforce, just a shout out to the fact that we need a strong primary care workforce, teams of people, not all physicians, obviously, but we need that, and we're losing that, but that's a topic for another day. I just have to underline that.
Very important, and they're very overworked, and it's tough. I agree. I think there needs to be a lot of work in that whole area. So really, what excites you in the current developments that you're seeing today with technology? What is that biggest thing that really excites you? And I think we've touched on it a little bit, but I think maybe we could emphasize it a little bit.
Well, what keeps me going and what keeps me doing what I do every day in a variety of different areas, not just in digital health, but I think we can make it happen. It's as simple as that. I know that the elements, I work with a really incredible group of people. The company happens to be Jasper Health. Incredible group of people who came out of a consumer-facing organization initially, but they work, and I'm thrilled to be part of the team, but they're doing the work. They are an incredibly dedicated group of people. they're not alone. There are a lot of people out there who have the same motivation, and they really hold deep in their heart the need to make this happen. And so I think this is the time. And I have a vision, and my vision is probably years down the road. I may or may not be around to see that vision come true, but I think we're on that path. And I think we're on the path where we, as I've mentioned, where we can take technology to improve care, to improve outcomes, to reduce burden, to make more efficient use of scarce resources. Mental health is clearly top of mind these days. Financial toxicity and counseling is clearly important. Support for children of parents with cancer. I mean, all of those things. I think we have the technology. And, you know, it's how many times, and I don't know what your experience has been, look at pre-authorization. And you mean to tell me in this day and age when we can do our financial transactions or book our airplane flights or find out how our plane is late or whatever, and I'm on that telephone we mentioned earlier, you mean to tell me we can't figure out a better way to monitor and get that done? I won't say the word I'm going to say, but get it off the table for people. And by the way, let me say something. It's not just expensive for the clinician sitting in the office and for the staff that does it. It's expensive for the people on the other side of that as well. They've got to have people to do it. So monitoring quality, making sure that people don't drop off the face of the earth, and making sure they get the right care. There are a lot of forces at work here to make care less expensive. If you make care less expensive in a positive way, in a good way, that's okay. But some people are going to make care less expensive by maybe not giving care. How do I, as a patient, how do I, as a family, make sure that there's some oversight, some quality metric? We can't do that today.
Yeah.
Come on, let's get real here, people. Yeah. We can do a lot of things, and that one that keeps me going. That's what keeps me going. And whether it's in the delivery space, whether it's in the early detection space, whether it's in the treatment space, let's think about what we can do to improve this process, move it more to the patient wherever they may live, and find, by the way, in clinical trials, find those people where they are for these drugs that we have that are treating smaller and smaller numbers of patients. The targeted therapies, I call them the 1%, but now we're down to the 1/10 of 1%ers who may benefit from it and make the cost of that research and delivery of that drug more acceptable, so we can, again, find the patients, find the drugs, get the medications to people, and yet try to do it at a cost that is the people can afford and provide a sufficient return on investment for companies to be willing to continue to move down the path of new cancer treatments.
Yeah, absolutely. And I think what excites me is the concept of like having a caregiver in your pocket. And I think, you know, looking at chronic disease, looking at diabetes or cancer, people need that hand-holding. They need to have somebody there. I know last week I had somebody call me at midnight worried about their insulin because they skipped their insulin dose. And do I take it or do I not take it? And I thought to myself, you know what? If I wasn't there, if they called the physician office, they wouldn't get anybody, right? Or they'd have to wait till the morning. So just thinking of the comfort of having somebody there like 24/7 at your fingertips to help you through some of these things, to me is like amazing. And what a comfort it is for those caregivers and people out there to have that kind of support. So I'm excited about that because I just think that is the missing link today. That connection between visit connections is really what's missing.
So I've got to share, everything in life is a story for me, right? And the story goes back to early 2000. I came to the Cancer Society, American Cancer Society, about 2001. And shortly thereafter, they had an advertising campaign. And they still, I don't know if they don't have the building anymore, but they had a big picture on the wall that came out of that advertising campaign. And the campaign, and still, I got to tell you, it still makes me emotional. It was a house that had a light that went on. You heard the crickets in the background. It was 2:00 in the morning, and somebody was reaching out for help, and somebody answered the phone.
Yeah.
And happened to be the American Cancer Society, and they said, "Can I help you?" And maybe it was just to talk. Maybe it was just to say, "I'm here, and I need to talk to someone." We cannot forget how important, as you mentioned, we cannot forget how important that touch is.
Absolutely.
And every day, but particularly when you're facing a life-threatening, potentially even fatal illness, or even if you're in the last stages of life. So how do we take, and you know, technology is not just about dots and dashes. It's about people. And technology always has to be focused on how we can help people. And if we just concentrate on the dots and dashes, we will not succeed in achieving our goal and achieving our possibilities.
That compassionate side that has to be there in order to provide good care. Great. Let's talk for a minute about AI and how do we use it to like really improve access to timely care? And if you can maybe touch on that a little bit, especially post-discharge.
Well, great question, because if you know, when you can tell me what AI really is, I'm sure there are people listening who say, is he kidding? Blah, 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 you know, whatever. But I look at AI as what are the functions? So I want to know if somebody goes home from the hospital, a couple of things I want to know. Did they get the follow-up they needed? In other words, if they didn't call, you know, do we know that they didn't call? I want to know I'd like to know what maybe their vital signs. You know, we do a lot with congestive heart failure. We talk about scales and monitors and heart rates and all that. But we've got a lot of information we can do with patients with cancer to make sure they're on a good course. What are we going to do, as I mentioned earlier, to monitor the quality of care? What are we going to do to monitor and get rid of all the pre-authorization? You know, that is artificial intelligence. And then what are we going to do to make sure that person is going to get the best outcome possible based on what we already know and as we update that information on a daily basis? So AI, to me, I call it augmented intelligence. I don't think it's going to replace people. There's a whole discussion about learned intermediaries and looking at it, and the anesthesiologist presses the button. Do they need more anesthesia, whatever? I'm talking about how do you take data and make it work. So, for example, we are a little bit, you know, one of the topics that I'm interested in is how can we tell people what the cost of their care is going to be? You would think that we have so much data we could press a button and give it. Well, we don't. We don't. And how do we get the best outcomes? And you know, organizations like ASCO have accumulated tremendous amounts of data, made a tremendous investments, have had a number of, you know, like every other endeavor, they may have had some false starts, but they have good people working to make it happen, to tell us about patients like me. What is the best course? And also, how do we interact with patients to make sure we're doing what the patient wants?
Right.
You know, and in other words, as you get older and as you may become more frail, what is the best treatment course? So, you know, I'm looking at data and I'm saying, how do we take data? How do we use data? How do we take data to give treatments at home and monitor a patient? And how do we signal that there's an issue or problem or that everything's going just fine? I don't know if that's responsive to your question, but I'm looking at data. You know, we have real world evidence. You want to talk about AI? We have all this data out there. And some organizations have taken that data, massaged it, and are coming up. You know, COVID, let's talk about COVID. Can you imagine in this day and age that we don't have data resources that can tell us what the heck is going on around our country with people? That maybe we have a piece here and a piece there? Really? I mean, so
COVID has shed the light on that lack of data exchange and just looking at the whole picture of it. Yeah.
Right. I mean, and we need to be able to assure privacy. We need to be able, but we need to have access to data. We need sentinel institutions, perhaps, and we've had them in other arenas to tell us what's going on. Cancers have been impacted disproportionately as a result of the pandemic, whether it be screening, and I thought at the time I was engaged in a discussion about we can't go out and get routine screening, but that was where we were at that moment. But what are we doing with our population today? What are the outcomes? What are things that work? What are things that don't work?
Right. Yeah.
Imagine the possibilities if we had the information, and I do know that people and organizations are working on that and can't wait to see the results. Let's put it that way.
Yeah, predictive analytics, I think, is going to be really kind of the future, even within behaviors. You know, I think about the I mean, just even like something as simple as what people eat. People tend to eat the same thing, and you wouldn't know that if you just saw somebody maybe for 15 minutes every 3 months, right? But technology tracking that could really like pave the way for like what to do in the future, or how to dose, or recommendations. I just see so much value to just having the whole predictive analytic piece of the data that we're collecting. So a lot of, I think, exciting things can really happen. I think we just have a few more seconds actually, but just talking about payments, and you've been kind of like the leading voice on physician payment issues. So just kind of like in a nutshell, what do you think needs to change? Because I don't think we're all totally into value-based, and we're still fee-for-service, and I think it's kind of like a mixed match out there. But if you could just shed some light on that.
So I think physician payment in general is a very difficult place. And I think, with all respect to my colleagues who are specialists, I think it's directed in a wrong direction. I think physicians should be compensated for the time, the effort, the education that they put in. We have a payment system that's rewarding machines and not people. So too much to get into here, but I've felt for a long time that we're really focusing more on how we pay for an MRI and reimbursing for an MRI machine than we are for the skill set the person's doing. And I mentioned primary care earlier. There's no question. So I think there are an incredible number of disincentives. The hope in value-based care is that we are going to be able to figure out how to give the best care within a reasonable budget. And sometimes the drugs are going to be expensive, and we have to be able to account for that. I don't think the current piecemeal payment system is conducive to trying to get people to figure out how to give the care. So we're going to need a tremendous reorganization of payment. And I've made predictions in the past. I have to say that part of me says we're going to have to go to a national system to make sure everybody gets care. And then there's part of me that says private companies should be able to figure this out. I hold out hope. And I'm going to be honest, it's a struggle. But we have too many people being left behind. And that's what we have to focus on. We have to figure out how to get care. I happen to think value-based care will work, but a lesson from the past, when I tried to get involved in this literally 30 years ago, it takes a lot of intellectual capital on the part of people who are giving the care and on the part of people who are receiving the care. Mm-hmm. And quite frankly, at the end of a long day, there's not a lot left over in terms of being able to offer intellectual capital. That's a lesson I learned 30 years ago. And I think that people need to be involved in saying, what is the care they want? And we have to be involved in saying, how can we what's the care we can deliver? And then in the middle, we come back to digital technology. How can we make that happen more effectively and efficiently within the healthcare system, as other industries have done over time?
Absolutely. Yes. That's a whole other discussion too, this whole payment system, but you've been great shedding some light. And really, I mean, our time is up, but we really appreciate your insights and your candid discussion on some of these really, topics today, especially around the use of technology in healthcare and especially with chronic disease. So you've been amazing, and you have an amazing career, and we really appreciated you spending some time with us today. So thank you very much.
And thank you. I really appreciate it. Thank you.
The bigger vision of Reimagine Patient Engagement is to build a community of healthcare transformers working to improve patient outcomes. Patient engagement requires patients to be in the circle of care to ensure that care is holistic and not as a snapshot during a moment of crisis, but as a view that is ongoing, continuously enriched and deepening over an entire lifetime. So, to be part of this amazing community and contribute to the vision, reach out to us at www.connectedcarecircle.org. That's www.connectedcarecircle.org.